Good evening, everyone, and thank you for joining us. Tonight, we will be having our Year 3 bootcamp, where we emphasize the change from preclinical to paraclinical sciences. So these are the contents. I wouldn't go into detail. So I would like to congratulate everyone for making it a Year 3. I know I can imagine the past 2 years have been tough, but you made it. And I just want to go into a little bit of background behind the concept. So the concept behind this virtual event is based on the difficulty to transition from preclinical to paraclinical sciences and the overarching tone of pathology in all aspects of the third-year syllabus. So what we aim to do tonight is to provide advice to you, third-year MB.BS students, on how to manage the various components of the syllabus so that you will be better prepared for your third year of studies that can very easily become overwhelming. So our hope tonight is that this virtual event will provide the needed insight to allow easy acclimatization into the Year 3 experience. Additionally, we are trying to make it as interactive as possible, so please feel free to ask us your questions. I just want to emphasize a few disclaimers. So the Pathology Club of UWI operates within the established policies of the Faculty of Medical Sciences of the University of the West Indies as stated in our Constitution. The session is intended to provide an overview of the Year 3 MB.BS syllabus based on the experience of us 4th and 5th year students who have volunteered our time. It is intended to be an interactive session. It will not provide information on any faculty members, faculty decisions, or any material against the policies of the University of the West Indies. Again, I would like to emphasize the intention of this event is not to provide information on any faculty members, faculty decisions, or any materials against the policies of the University of the West Indies. We do not condone or encourage any activities or behavior that is in violation of UWI's policies and the club's core values, and we reserve the right to immediately remove any participant who violates UWI policies or any of the core values of the club, namely respect and camaraderie, whether by verbal or written form. So we're just going to have a little icebreaker. So I can imagine everyone is thinking, okay, I'm going to ask everyone to go and say 2 interesting things about themselves. And I could imagine everyone's expression, but no, that's not what we're going to do tonight. So we just have a nice little video to play for you.
Oh, Lionel, glad you came, mate. Can I get you a drink?
Yeah, something soft. I'm driving. Parking's an absolute nightmare around here, isn't it? Had to reverse into the tiniest of spaces. Still, I managed it. I mean, parking's not exactly brain surgery, is it? And I should know.
Why is that? Are you a doctor?
Careful, not a doctor. I'm a brain surgeon. Big difference. Big difference. Yeah, I actually know a joke about this. What's the difference between a doctor and a brain surgeon? One's not exactly brain surgery. The other is brain surgery. So, what do you guys do?
I'm an accountant.
Oh, that's good. Yeah, I could do with an accountant. Filling in those tax forms can get really confusing, can't it? Still, it's not exactly brain surgery, is it? I mean, brain surgery, believe me, is very complex. Are you an accountant too?
No, I work for a charity.
Oh, that's a very selfless job, isn't it? I really admire you. I don't think I could ever do what you do. I say that because it's emotionally draining, not because it's hard. I mean, it's not exactly brain surgery, is it? Which, as a brain surgeon, is what I do.
Lionel, here's your drink. Lionel's a brain surgeon, you know. Yeah, he mentioned it. Oh, Jeff, they keep you late at the Space Centre.
As always.
And this food round. Have you met Lionel?
No, hello, Lionel.
So, Jeff, how do you earn a crust?
Well, I'm a scientist. I work mainly with rockets. It's pretty tough work. What do you do?
Well, I don't mean to boast, but I'm a brain surgeon.
Brain surgery? Not exactly rocket science.
I hope you all enjoyed that little video. So what it spoke to is humility. So I know sometimes throughout our medical career, we can forget ourselves along the way and the reason why we're here in studying medicine. So I just want to remind everyone that being humble means that we recognize that we're not on the earth to see how important we can become, but to see how much difference we can make in the lives of others. Right? And the best way to find yourself is to lose yourself in the service of others. So on that note, I would like to hand you over to Samantha Simbu, who will be giving an overview of the Year 3 experience.
Thank you, Anne-Marie. Good evening, everyone. I'm Samantha Simbu, a current 4th year MB.BS student, and I will be speaking on the overview of Year 3. Once again, congratulations to each and every one of you for making it to Year 3. It's a very big accomplishment, and you all should be very proud of yourselves. So Year 3. Year 3 consists of 4 courses. So MDSC 3311 and MDSC 3312 during semester 1, MDSC 3313 during semester 2, and MDSC 3314 runs for both semesters. So I would first speak about 3311, 3312, and 3313. Components of each course include anatomical pathology, chemical pathology, immunology, hematology, microbiology, pharmacology, and public health. You will have lectures on these. Semester 1 begins with 3311, followed by PDQ, which is a structured answer paper, which tests all the course components. Then this is followed by 3312, your other PDQ. You will end the year with your phase exams, which will be in December. Semester 2 begins with 3313 and follows the same pattern. So you would have 3313, then PDQ, then your phase exam in March. 3311, 3312, and 3313 has the same pattern with respect to grading. So during the semester, for each course, you will have PBLs on Tuesday evenings. No yellow forms, just participation marks, which is with 5% of your final grade. PDQs with 25%, and phase exams are with 70%. Now 3314. There are 5 clerkships: anatomical pathology, chemical pathology, immunology, hematology, and microbiology. Clerkships begin during semester 1 and continue into semester 2. You will spend 4 weeks in each clerkship, followed by assessments done during the last week. Each clerkship has different ways of doing assessments. The assessments for each clerkship is with 5%. In total, this amounts to 25% because there are 5 clerkship rotations. There are 6 pharmacology quizzes, which consist of 10 multiple choice questions. Each quiz is worth 0.83%, and in total, the 6 pharm quizzes amounts to 5%. These quizzes also begin during semester 1 and continue into semester 2. An additional 5% comes from the mini-OSCE and mini-OSCE you did in year 1, 2, and 3. So you will have another mini-OSCE and mini-OSCE, similar to what you did in year 1 and 2, and this usually takes place around February. Your major OSCE, which is the multiple choice questions, in March is with 40%. Your major OSCE is with 25%, and more information will be given about this further in the session. I will now pass over to Saksha Mehra to continue with this presentation.
Thank you very much, Samantha. Good evening, everyone. I am Saksha Mehra. I'm a 4th year medical student. I am honored and humbled that the Pathology Club of the University of the West Indies has asked me to speak today and share my insight with you regarding my Year 3 experience. I would also like to congratulate the club for this wonderful initiative. I hope that this session on the different courses that are offered in Year 3 will provide the needed insight to allow easy acclimatization into the Year 3 experience. So why anatomical pathology in Year 3? So pathology, as you would all appreciate, is basically that bridge between science and medicine, as it underpins every aspect of patient care, from diagnostic testing and treatment advice to using cutting-edge genetic technologies and preventing disease. So basically, the courses offered in Year 3 will focus on the pathophysiologic basis of diseases, investigation and interpretation in the process of making a clinical diagnosis, therapeutic management of diseases, and finally, prevention and primary care, along with psychosocial issues in the disease management. So the pathology courses that constitute the Year 3 program will include MDSC 3311, which is Applied Paraclinical Sciences 1, MD.SC 3312, which is Applied Paraclinical Sciences 2, and MD.SC 3313, which is Applied Paraclinical Sciences 3. So let us first talk about MD.SC 3311. So this course will basically enable you to understand, comprehend, and apply the knowledge of pathophysiological and morphological changes of some of the common diseases involving the cardiovascular as well as the respiratory systems. So, okay guys, so I have a little quiz for you all. It should not be too hard. You can feel free to answer. You can also make a guess. That's completely fine. So anybody would like to make an attempt, you guys can open your mic and speak and identify what do you think this picture represents and what kind of pathology it can be. Anybody can feel free to open the mic and answer. And you do not have to be correct, just make a guess, that's fine. Anyone would like to make a guess or make an attempt? What do you think that this picture represents? I saw somebody open the mic. Anybody? Okay, so this basically is infarction, and this will be covered with shock as well as thromboembolism in your 3311 course. And next one. So anybody would like to make an attempt at this? So this is atherosclerosis, and this will be covered together with the topic of aneurysms. Okay, this should be a very simple one. Anyone would like to make a guess?
Is it an embolism?
Sorry, I didn't hear you.
Is it a pulmonary embolism at the heart?
Good attempt, but this one is infective endocarditis. And you will also be able to cover this topic with other heart diseases and congenital heart diseases. But good attempt, thank you. Next one. This should be a very simple one. I think you guys should be able to answer this one. Anyone? Okay, so this represents myocardial infarction, and this is an ischemic heart disease, and this will be covered with the topic of congestive cardiac failure. Next one. Anybody would like to make a guess for this one? Okay, so this is pulmonary tuberculosis. And this will also be covered with the topic of pneumonia. It is a very important topic, so I would like to suggest that you guys read a lot on this topic. Next one. Okay, so this one is bullous emphysema, and this topic will be covered in your 3311 course under the topic of chronic obstructive airway diseases. Next one. Anybody would like to make attempt at this? I can give you a hint. This pathology deals with the gastrointestinal system, the GI system.
Crohn's disease.
Correct. Very good. So the picture on the left represents Crohn's disease, and the picture on the right, it represents ulcerative colitis. And you will also be able to appreciate the pathology of the stomach as well as the small intestine, as well as the lower gastrointestinal tract in your MD.SC 3311 course. Next one. Okay, so this pathology represents cirrhosis. So this is the pathology of the liver. And this is also one of a very important topic that you will cover in MD.SC 3311, which is the first block in year 3. as well as you will also cover the diseases of the biliary tract. Next one. Okay, anybody would like to make a guess for this one? This one is also relatively easy. Okay, so this picture represents pyelonephritis. So this will be covered together with other topics, the glomerular diseases and other diseases associated with the kidney, the renal system. Next one. Okay, so basically the pathologies that I just mentioned will be some of the topics that you will be covering in the first course, which is the Applied Paraclinical Sciences 13311. So let's move on to MDSE 3312 now, which is Applied Paraclinical Sciences 2. And this course will basically enable you, the medical students, to appreciate, understand, and apply the knowledge on the study of pathophysiological and morphological changes of some of the common diseases involving the gastrointestinal, hepatobiliary, genitourinary, as well as the endocrine systems. And application in clinical cases is extremely imperative in year 3. So anybody would like to make a guess at what this picture represents? I can give a guess. I can give a hint. This represents the pathology of the female genital tract. So this is basically invasive ductal carcinoma. Next one. Okay, so the picture, as you can see on the right, it basically represents the nodular prostatic hyperplasia. And these are some of the topics that you will be covering in 3312. And this is the pathology of the male tract. Next one. So anybody would like to make an attempt at this one? This is a fairly easy one.
Is it liquefactive necrosis?
Sorry? Did you mention liquefactive necrosis?
Yes.
Okay. So this one, basically, this pathology is representing pyogenic meningitis. And this will be covered under your CNS, central nervous system infections. Next one. Okay, so this one also represents brain tissue. So this is basically cancer, and this represents glioblastoma multiforme. So this will be covered under your intracranial tumors. Okay, so this pathology, the picture that you can see, it represents osteosarcoma. So this will be covered with the topic of bone neoplasms and tumors. And other topics that you will also cover will include diseases of the endocrine system, vascular disorders of the CNS, and some of the common non-neoplastic diseases of the bone, including fractures and healing as well. So these are basically some of the topics that you're going to cover in MDSE 3312, sorry, as well as MDSE 3313. Just would like to mention that many of your exams in year 3 will test your problem solving and reasoning ability rather than mere factual recall. So the examination is intended to test your abilities in year 3 so that you can sequentially and logically solve a clinical problem by requesting investigations required to aid in the understanding of the problem, as well as the interpretation that will lead you to arrive at a particular diagnosis. So with this information, you will then be able to design a therapeutic plan to manage the patient. So great. Now I would like to just share some important study tip with you guys, especially since all of you guys are now in paraclinical year. Personally, I absolutely loved and enjoyed year three. I learned a lot in year three, and I hope you also acquire a lot of amazing information in year three. So I would say start organizing a study plan from day one. Please do not wait until the 11th hour. And please do not cram and regurgitate. Leave that for years one and two. This is a paraclinical year, so that is not going to help. And it is extremely important that you critically think and apply the knowledge. And this process will be extremely beneficial to you guys because critical thinking is an important skill that will move you from concrete ideas to abstract and infer concepts. And critical thinking will enable you guys to analyze outcomes, synthesize information, and appropriately apply your information in your exams as well. And of course, integration and self-monitoring is extremely important as well. So thank you very much, guys, for listening. I hope the information was helpful, and I wish you guys very good luck.
Hi, guys. Good afternoon. I hope you all are doing well. I hope you all are staying safe in this time, and I hope the first few days of year three was maybe different, but I hope it was productive nevertheless. I'm Jeremiah. I'm a fourth-year medical student now, and I just want to briefly take you guys through the clerkships and pharmacology and basically 3314, which could be quite confusing. I'll admit I didn't quite understand it until probably semester 2, but this is what this is for, right? So as Samantha eloquently shared with us early on in the presentation, the overview of 3314 is that you have your 5 clerkships plus your pharmacology quizzes, as well as your OSPI and OSCE score, which gives you your 3314 grade for the year. As Samantha also said, it's actually running from year 1. Remember when you all had we had all mini OSCEs and OSPIs at the end of the year? That little 1-2% is going towards this 3314 course, but you're going to do a bulk of the heavy lifting of this course in this year coming up. So I want to just take you through the clerkship. So I couldn't do this on my own, so I asked a few of my friends, what is something you wished you knew about clerkship specifically before going into year 3? And the first one said, I wish I had a better explanation of exactly how clerkship works. Another one said, they knew how much they wish you knew how much work clerkship was, and by extension year 3, because I'm sure you're probably starting to already gather that year 3 is pretty a content intensive year. Another one said, looking back, how applicable the content is, we're in year 4 now and we're online just like you guys. And a lot of the things are concepts from year 3, concepts from clerkship we actually have to apply now in the clinical aspect of medicine. And finally, someone said, looking back, I wish they knew that everything would work out and at any given time they knew much more than they thought they knew. And this is a syndrome that we all medical students suffer with. We believe that we don't know anything at any given point in time, but trust me, you know more than you do. So I just want to give you some first words of encouragement before I go on. I want to remind you, anytime you feel stumped, look at all the people in front of you, myself, Saksham, Nail, and Marie. And if we made it, trust me, you can more than do it too. All right? So my plan for today is to basically go through what clerkships are, what the purpose of clerkship is, give you some pearls for success, and then we'll tie it all together at the end. All right? So we have 5 clerkships. We have chemical pathology, anatomical pathology, microbiology, immunology, and hematology. All right, so if we look at chemical pathology, the purpose of the chemical pathology clerkship is to grasp a biochemical approach to common diseases. When you see a diseases, you should already see an image of what your biochemical results should look like. So we want to start applying biochemistry and chemical pathology to patient care. Anatomical pathology, we want to understand how the pathophysiology of specific diseases affect different organ systems. And therefore, if we understand that, how is treatment, where can we target treatment, and have a more in-depth understanding of that. Microbiology, similarly, we want to understand the nature of microorganisms, and therefore if you understand how microorganisms cause disease, we can reason treatment for these diseases. Immunology, the foundation of immunology is to understand self versus non-self, and we'll be doing a lot of that this year. And when non-self versus non-self goes wrong, how do we treat it? And hematology, which is very, very important. If you think about it, if you go to the hospital, the first thing they're going to do is a blood test. You want to understand the approach to common hematological conditions, as well as understand how the blood bank works, how blood products works. So let's go in a bit more detail into each clerkship, and I'll try to give you some pearls here for each one. So biochemical pathology is the approach to common diseases applying biochemistry to patient care. I'm not sure how it is now, and I forgot to say, I know the situation you guys are facing now is completely different to what we faced a year ago, and maybe some of these tips may be applicable, but I hope you can still grasp something from it. And I know for our year, these sessions were facilitated by Dr. Davis and Professor Nwaka. And the first thing I want to remind you guys is what these guys say is extremely important. What they say, what they repeat in classes is just as important as what is on the slide. So if you have to write, if you're a writer, write down everything they say, because trust me, some of that same content is going to be tested. So if we look at what Prof. Ezenwaka covers, he covers a lot of the justifications for biochemical investigations. Why do I need to do a biochemical investigation? And I'm pretty sure for those of you who started with ChemPath, he probably would have asked you, so what are the 6 justifications for biochemical investigations? We did that in 10B, right? So that is very important, and he forms the foundation of the clerkship on that. He would also cover things like renal function, liver function. He spends a lot of time on diabetes, interpreting the results of diabetes, and some time on errors. Dr. Davis spends a lot of time on the urinalysis, both microscopic and gross, that's a typo there, my apologies, as well as therapeutic drug monitoring. The assessment here is both an MCQ, part of it is MCQ and part of it is short answer. What I want to remind you again is what these guys say is just as what is important as what is on the slide. All right, so that's ChemPath for you in a nutshell. And Path, very interesting, very intriguing. I don't know to what extent you guys would get to go to or what is in place for you guys, but these sessions are facilitated by Dr. Shrikant, Dr. Wayne Mohammed, and Prof. EBC Rao, who's actually the academic advisor for this group. And it's structured, well, for us, there was a didactic component, lectures, and a more component. I'm not sure how it's working out for you guys right now. But for anatomical pathology, and I'll argue for your entire year 3 experience, for every condition, you need to know these things. You need to understand the risk factors and the epidemiology. You need to know the pathophysiology of the disease, why it is happening, how it is happening, and how the pathophysiology affects other organ systems. You need to sort of relate the pathophysiology to the history and the physical exam. You obviously need to internalize and conceptualize the pathology findings that you would find. This is anatomical pathology after all, both the histological findings and the gross. Understand some concepts about treatment based on the pathophysiology. And if you use this approach to every condition you come across starting from now, trust me, when you enter into clinical years, you would already have probably a few steps ahead of your colleagues who would have just gone off memorizing stuff. As Saksham said, year 3 is about concepts, it's about critical thinking, and anatomical pathology is no different. I'm pretty sure you all already know that Pathoma is an excellent resource. I recommend it highly. It speaks to concepts. The assessment here, I'm not sure again how it would work for you guys, but there was a presentation for us, and we had to follow the same approach to anatomical pathology where we went through these headings. There may be a quiz as well as an autopsy report. I'm not sure how this would work either, but I want to say something about the autopsy report. If they give you some findings or if they give you some demographics from a patient, don't just write up possible causes of death as you see it from the Robbins. Try to link the patient's presentation, link whatever results are given to possible causes of death or likewise. So don't just copy and paste from the Robbins. All right, the Robbins is the recommended text for ANPAT, so just try to link everything together. It's about critical thinking now. It's less about repetition and regurgitation. All right, so we're moving on now to hematology. Probably my favorite clerkship. And here we looked at common hematological conditions as well as the use of blood products. You know, our blood could be separated into different components. When we give it, what are some possible contraindications and complications that can occur? So these sessions were facilitated by Dr. Charles, Dr. Boomer, and Mrs. Villafana. And it had two components. There was the lab component, which was facilitated by Mrs. Villafana, as well as, well, for us, there was a sort of a clinical component with Dr. Charles, but I'm pretty sure that the replacement for that would be just as efficient for you guys. As I said, we focused on the approach to hematology. We looked at results and interpreted results based on how patients presented. So we had emphasis on anemias, malignancies, and blood products. Off the bat, I want to recommend to you guys, look at the Hofbrands. It's an excellent, easy-to-read book for hematology. The Oxford Clinical Medicine is pretty good as well. That's the little yellow book. Personally, I recommend this guy called Medicosis Perfectionalis on YouTube. Kind of annoying voice, but he does an excellent job at explaining hematological concepts, as well as the pathomas, or the hematology chapter in pathoma is pretty good as well. All right. When we look at the assessment, just before that, the lab session, we look at the blood films. You know, you can take a sample of blood and smear it on a blood film and look at the cells themselves of the different components of blood, and you can pick up different pathologies because they are hallmark findings. So what I'd recommend to you guys is when you get those, when Mrs. Villafana goes through that with you, you form maybe some flashcards. I used Anki to help remember and to consolidate the findings on the blood film. All right. The assessment for us, it was spotter based on the blood film, as well as there were some MCQ questions on lecture content. Finally, we had the last two clerkships, microbiology and immunology. The microbiology was facilitated by Drs. Kehade, Dr. Unakal, as well as Prof. Akapaka, right? It's very didactic, yes, very lecture style, but use it to your advantage. And for these two clerkships, what I want to say is this, is even though, depending on where you do the clerkship, you may see advantages and disadvantages. For instance, if you do these clerkships at the beginning of the year, it would be tough because you're saying, oh, all these systems, all the immunology, all the microbiology you have to learn, but in the end, you would have covered microB and immunology for all of year 3. So you are a step ahead. And likewise, if you do it at the end, it's a nice review for you. So take advantage of it. All right. For microB, I want to recommend that you guys use Sketchy microB, especially if you're a visual learner. All right. And make sure and learn bacterial morphology, as well as the key aspects as it relates to treatment and how the treatment works and how the treatment, whether it's a bacteriostatic drug or a bactericidal drug, how it affects the bacteria or virus. All right. Immunology. Immunology is probably, I would argue and say, probably one of the more difficult clerkships. And the only reason I say this is because a lot of the language of immunology is pretty new to all of us. So my advice for this is to do your lectures early and do it twice. Do them early and do them twice. The assessment for both of these clerkships are MCQs. Finally, we have I have some advice for you guys as we conclude, as I draw my presentations and year 3 is not easy. And as Aksham said, make a plan, stick to it as best as possible. Strive for consistency. Something a day, doing a lecture a day, half a lecture a day, pretty much a bit more than half. But a lecture a day goes a long way in the long run. All right? Secondly, don't compare yourself. People will come and say, oh gosh, I come home, I mashed up 3 lectures last night. You don't have to mash up 3 lectures last night. But I want to encourage you to work at your own pace. Once you make your plan and you stick to your plan, it will work out. Thirdly, guard your mental health. I've seen friends, I've seen colleagues who had a crash in year 3 because of the sheer amount of work that it was. But once you make your plan and you don't compare yourself and you stick to your plan, everything will be all right. Guard your mental health. If you feel that it's becoming too much, make sure and have somebody to talk to. As I said here, study hard, but party harder. All right? Lastly, learn for life. We're going to stop learning to just pass exams. Yes, we have exams to pass in year 3, probably the most exams that you do up to this point. But try to ingrain some of these concepts into your mind, because as I said, you're going to be taking them forward into year 4 and 5. As I said here, it's going to become your bread and butter. All right, so those are a few tips of advice, feathers of advice I wanted to share with you guys. And finally, I just wanted to highlight the pharmacology. So the pharmacology quizzes account for 5% of your 3314 grade as well. You're going to have a few in 3311, a few in 3312, and 3313. Tulane, it's not on the slide, but Tulane is a very good resource for the content of the pharmacology. And of course, your seminars are mandatory. They're not mandatory, but I really advise that you go to them, because they get to the point and they enforce the concepts that our pharmacology tutors want us to know. All right. I hope the presentation was helpful. I hope that you guys enjoy your year 3 experience, though it's completely different to what we would have experienced, but I hope you learn. And of course, if you have any questions, feel free to message me at any point through Anne-Marie or any of the exec members here. And I wish you guys a successful year. Stay safe in this time, and I wish you guys the best of luck. Thank you. Now I'll pass over to Kenisha, and she will take you guys through the PDQ.
So good night, everyone. Thank you for joining us for this session, and thank you, Jeremiah, for that wonderful presentation and very informative one. So now I'll be taking you guys through the PDQ section of this presentation. So what is basically PDQ? Because you will now be introduced to PDQ in year 3. So PDQ stands for Progressive Disclosure Questioning. So I know some of my colleagues in year 4 and 5, when they first experienced PDQ, could relate to what is being showed on the screen. Because if you didn't study a topic that comes on the exam, you could feel like this and feel like the whole world is going to end, basically. So now I'll try to give you guys some tips on how to study and what basically is PDQ, so you'll be able to handle it much better than we could. So now, as Saksham said before, cramming does not help for year 3. So as we all know, year 3, we have a lot of content to cover in year 3, and also a lot of content to cover, and the time is limited. So make sure and manage your time. A helpful tip I can give you guys is at the beginning of the semester, get a calendar, so print out a calendar, and if you know the dates of your clerkship exam, farm quizzes, PDQ, phase exam, plan out everything. So put everything down on the calendar so you know how much time you have to study in between everything. Because you don't want to have a farm quiz one day, 2 days after you have PDQ, and then you're rushing. You cannot study for PDQ in 2 days. Next slide. So I'm going to give you some tips of how to study fit. So some people would some people would find that since the time is limited, they are able to be home. Well, we are home now since online sessions. They are able to not attend lectures, just watch videos, study from the textbook, and be able to pass the exam. However, I want to encourage everyone to attend as many of the online sessions as possible, because during these online sessions, the lecturers, they hint to certain topics, to certain parts of the lecture that are important, that could come as MCQs and fails, or might be important to study for PDQ, or for just general important to know in your medical career for year 4 or for year 4 or year 5. So it'll be beneficial to you to attend these lectures and at least write down the important points. So when you're going over the topics, you make sure to cover these points and make sure that it's ingrained within your memory. So review the course objectives. So before you sit down to study a topic, I want you guys to get your syllabus. When you're going to study the topic, see what objectives you have to know for that topic and write it down. So you know at the end what you have to cover, what you need to know, so to make sure, because sometimes some of the course objectives is not covered within the lecture, and it's self-directed learning. So you have to go to your textbook or go online and find the information for yourself and make sure and know it. So it's be helpful to make sure that you cover everything at the end of the day. So videos. So as Jeremiah said before, videos are very helpful. For ANPAT, for Toma is very helpful, and for microbe sketchy, videos are a lifesaver, because microbe could be a lot. It's a lot of contents, a lot of microorganisms, a lot of everything you have to know for microbe on top of everything else. So if you're a visual learner, especially, Sketchy Micro is a lifesaver. So for Sketchy, you also have Sketchy for pathology and Sketchy for farm. Sketchy farm is also helpful for visual learners and any kind of learner, basically. But you may not have time to sit down and watch a 20-minute video or 30-minute video. So you could find which videos work for you and just sit down and fix it. Because remember, as I said before, time is limited, and so you want to make sure not only work hard but also smart. So summaries. So when you're sitting down to review a lecture, so before you start to actually review the lecture, first have your objectives in front of you to know what you have to know. Second, you can either watch a video before the topic to be able to refresh your memory to know what it is about, and then go over the lecture. It's helpful when you're going over the lecture to make summaries one time. The summary should be concise, easy to read, and contain the important points on the topic, because you don't want to have to be now going to look over your summary and can't understand what you read or what you even wrote within your summary. So create practice questions for each topic. So when you have the course objectives in front of you, you could know what the lecturer could ask for questions. So it'll be helpful to make up your own practice questions to be able, so when you're reviewing it, coming closer to the exam, you could do those questions to be able to refresh your memory on what you need to know and review as much as soon and as much as you can. So I want to encourage everyone for every week to at least review some of the work material, some of the work, because you don't want, I know it might be hard over the weekend because everyone has other things on top of med school. It might be hard over the weekend to go over everything that you covered during the week. At least cover as much as you can. Doing some work is better than doing no work, because at least you will have less work to go over coming closer to the time of your exam. Next slide. Okay, so what kind of questions are asked basically? So as Samantha said before, these are the different topics or disciplines you have in year 3. So you have ANPAT, anatomical pathology, you have ChemPat, microbe, immunology, hematology, pharmacology, and public health. So public health, you do get questions on public health for PDQ. So it's important to review your public health lectures. So what are some, So what are some of the questions that can be asked? So you have these 7 disciplines, so each discipline has a set of questions that can be asked. However, some disciplines are more heavily weighed than others. For example, you will have more marks allocated for the ANPAD section and the microB section compared to the public health and the immunology section. So when studying, make sure and go through all the ANPAD lectures and all the microB lectures, because most of the weight for the exam will be on those sections. So you want to make sure that whatever topic comes, you are able to answer those questions. And I know it's called PDQ, Progressive Disclosure Questioning. So it's not actually progressive. Progressive in the sense that if a question comes on TB, which is a disease that you must know in your medical career, if a question for ANPAD comes on TB, it's focused on that. It doesn't mean that for the PALM section, anti-TB drugs could come. So how it's laid out is that you have a STEM question. So you have a STEM question, you have a case at the beginning of the paper. When you have this case, then you might have an ANPAD section, or it might start with ChemPAT or hematology. It could start anyway. So you have that, you might have a question based on TB, for example, and then the ANPAD section will be based on that. And then the ChemPAT section could be based on that also. However, but the other sections doesn't necessarily have to be based on this. They could have a next 2 lines further progressing the case along. So the next 2 lines could be, for example, the patient is a known asthmatic. So what are some asthma drugs that the patient could use? So it could come on different sections throughout the paper. So you have to know different. You have to have at least some knowledge on all the topics that you covered within the course. Next slide. Okay, so I'll go more in depth into the different disciplines now. So for ANPAD now. Okay, so for ANPAD, it's basically the section comes on 1 lecture. So for 1 lecturer, I will be in charge of writing the ANPAD section. It's based on 1 topic, but it might not necessarily be based on, like say, if you have a lecture on disorders of the small and large intestine, it does not mean the question will come that broad. It will come on 1 specific disorder within that lecture. So it's important. On the slide, it might just be like 1 paragraph, but you might have a document and it has like a 5-page document for the lecture. And then the topic might come on just 1 paragraph within that 5-page document. So it's important to know a little bit of everything to be able to answer the question. So how the ANPAD questions usually come, you have to know definitions, you have to know microscopic features. So they might ask you, what are 3 microscopic features of a myocardial infarction? You must know like gross features are important to know also. So for example, questions to come is like, what is cirrhosis? What are 3 microscopic features, 3 gross features, and some complications? For ChemPAT now. So ChemPAT is usually simple and straightforward. Go to all the ChemPAT lectures because Prof. Edwin Walker and Dr. Davis, they hint in their ChemPAT lectures on important topics that you should know, important parts of the lecture that is important to remember. So to make sure to go over all the ChemPAT stuff, so it's usually straightforward. So examples of questions are what enzyme is specific to the liver, why is alpha-2 increased in nephrotic syndrome, which will make more sense when I do 3312. MicroB now. So MicroB lectures could be a little intimidating, especially in 3311, because you have a lot of microB lectures you'll be covering. Because I think for 1 week, well, when we were doing microB for 1 week, you had at least 2 microB lectures per week. So if you didn't go over that second week, you'll have 4 microB lectures to go over. So try to go over your lectures as soon as possible and make your little notes about it. So for microB, a question that could come, the lecturers always said no for every disorder or disease, no examples of bacteria, viruses, and parasites. So for example, if a question comes on sexually transmitted disease, they could ask you, name 3 bacteria that could cause it, 2 viruses, 1 parasite. For pharmacology basically know your lectures, know your drugs. So know like the mode of action, the side effects, so the uses of the drugs, contraindications, and the classification. So basically just go through your lectures and make summaries of each anti-TB drugs or asthma drugs, make summary of or everything so it's easier to go over after. For immunology, you have a small section for immunology in your PDQ part of it, but you want to get as much marks within your PDQ as possible. For hematology will be based on one topic. So it could come on basically anything. Hematology and ANPAT section is similar in their structuring. So it could be on indications of blood products or treatment for warfarin and heparin, or it might not even be based on one topic. So the topic could be sickle cell disease, and it could come on a complication of sickle cell disease, so acute chest syndrome, the whole question could be based on. So that's why I said make sure and know your topics, at least a little part of each topic, so you're able to still write on the question. Now, PDQ is not a whole long essay you'll be writing, so it's basically 1-line questions, 1-line answers or 2-line answers, and have your answers in your head and make sure it's able to fit within the required space. Anything that does not fit within the required space, I know you might be doing it online now, so let's make sure it fits within the space, because they won't be reading anything that is over what they expect you to write. Public health. Now, public health is basically as straightforward. Whatever's in the lecture, it comes on the exam. So examples are risk factors for STIs, method of screening, or prevention methods. So some of the questions are common sense. So at least read, if you don't have time to read the lectures, at least go to the different lectures that they have, because when you go to different lectures, it sticks. So if you don't have time to go over the lecture, at least you remember the lecturer saying this and that to be able to still answer the question. Next slide. Now, during PDQ, you should manage your time. Have a watch or something nearby and make sure and manage your time, because that time could fly by very fast. I know I talk from experience, especially because you might think, oh, it's a whole hour, an hour. I know it's about an hour and something you have for PDQ, and you might watch the paper, you know everything on the paper, but by the time you might spend too much time on one question, and by the time you reach down to the end, you're basically scribbling. So let's make sure and manage your time and be able to answer everything on the paper and put the correct answer, well, the thing that you think is the best answer for each question. And that's basically PDQ in a nutshell. So thank you everyone for listening.
Thank you, Kanisha and Jeremiah, Samantha, Saksham, for that insightful advice. At this time, we'd like to open the floor for questions. Is there anyone who has any questions? You can simply unmute your mic and go ahead and ask. Please feel free to ask any questions.
Can you hear me?
Yes, I'm hearing you.
Okay, I just have a question in terms of like studying all of the different disciplines. Would you suggest maybe making flashcards for all of them, or do you think that would be like too time consuming?
You're referring to the clerkships or the phase blocks itself, like 3311, 3312, 3313?
Right, the phase blocks itself, because I know it's like repetition, and I know like when you do like the Anki cards and stuff, it can kind of help you with repetition to keep going through the cards. But I'm trying to figure out, like, with time wise and trying to make the cards, would that be a good use of my time?
Well, the thing about it is you have to know everybody has a different study style, right? So in terms of, I may recommend, okay, yes, you do your flashcards, but in terms of for you, you have to know, okay, maybe this mightn't work because I could spend my time maybe watching videos or doing summaries, which might be more helpful. For me personally, what I use is I'm a very visual learner, so I would definitely recommend like us videos as well as summaries. So when you're doing your summaries, definitely use tables. Use tables for sure. It's definitely going to help. I know making the flashcards can be time consuming, but if in the past, like during year 1 or year 2, that has worked for you and has helped you, definitely I would recommend it. But you have to know how to manage your time as well in terms of that. I hope that helps.
Okay, thank you.
Hi, Anne-Marie. I'd just like to add to that.
Sure.
Also, it'd be helpful to make in summaries and flashcards for as much lectures as you can, because when you finish some clerkship, you would realize that some of the lecturers use the same slides that they use in clerkship in class. So basically, if you make good notes for your lectures in class or vice versa, if you make good notes for your lectures in clerkship, you'll basically be killing 2 birds with 1 stone. So you'll have 1 less lecture in clerkship or class to be making notes for.
Okay, thank you. Noted.
Anyone else would like to add in, Saksham or Jeremiah? Anyone?
Hi, I would just like to add. You want to go ahead, Jeremiah?
You go ahead, you have the mic.
Okay, so I would just like to mention that the lecturers provide the information is very good. So I would encourage you guys to actually take your time and read the lectures that are provided to you. And maybe you could just there are certain things which are very important. So what you can do is like highlight the main things, the key words which are present in the lectures. And I think that should be sufficient. And you can also look at, as Anne-Marie mentioned, you can look at some videos, and you can also read some textbooks, because some of the textbooks provide very relevant information related to the topic. So again, it depends upon your studying technique, but reading the lectures is something I would highly encourage you all to do. So that is it from my side.
Yeah, what I was gonna add is try to tailor your studying technique to change it. Remember, PDQ is going to be a big part of your assessment. 25% of your grade, that's a lot. And what I want to encourage you guys to do is to try to tailor your studying technique so that it facilitates answering PDQ questions. So something I used to do, and it's something you guys can look up. I used to have a Google Sheet. So before in year 1 to 2, I would take notes by just writing the notes. But what I would do now, and I still continue it into year 4 and year 5, is ask myself questions. So one column would have all the questions, and I would have the answers in another column. So I'm extracting questions from the lectures, and I have answers in the next column, and then I would blank off the answers, and that's how I would test myself and review. And to my surprise, some of those questions pop back up in PDQ. I had no idea how, but I sort of filtered my revision and study technique into that. So that's something that worked for me, something you could consider. There are apps that are good for it. I'm a techie, so I use Google Sheets. I use an app called Notion, productivity apps that can really help. So if that's your style, you can definitely consider that.
Thank you, Jeremiah, Saksham, and Kanisha. Are there any more questions? PDQ on 33, 11, 12, 13 for the year? Okay. Well, we have another question and answer segment coming up, so you could feel free at that point in time to ask the questions. So we just have a nice little video here. It's taken a little break because I know that was a lot of information to take in just now with PDQ and so forth. So this is a very applicable video. I really hope you'll enjoy it. It's very humorous, but it also speaks to a lot of things that we'll be encountering, especially not only in year 3, but when you move on to your clinical years.
Right, stand over there. Right. Now, Upton, this young lady has a little lump in the left breast. It's nothing serious, but she was quite right to see her doctor about it. And I want you to tell me what it is.
I don't know, sir.
Well, of course you don't. Of course you don't know. Find out.
Yes, sir.
Stop. Upton, am I right in thinking this is the first time you've met this young lady?
Yes, sir.
So you do not march up to her and make a grab at her bosom? No, sir. Remember your manners, boy. Now shake her by the hand and introduce yourself.
Hello, I'm Michael.
Oh, for God's sake. Miss Walker, this is Dr. Upton, who wishes to examine you, if you've no objections.
No, carry on.
Thank you. There you are, Upton. Get on with it. Stop! Control yourself, Upton. I spent the last hour teaching you how to examine a patient. It obviously hasn't percolated through to that atrophied conglomerate of malformed neurons you use for a brain that you ask questions first.
Sorry, sir.
Well, get on.
Yes, sir.
Oh, come on, Upton. You should have learned all the proper questions to ask from your blue book, which you obviously haven't bothered to read. Which is why I have taken the trouble to write them all down on the board. Now, see if you can at least manage to find out the patient's name.
Yes, sir. What is your name?
Marlene Walker.
She's Marlene Walker, sir. And address?
13 Norris Road.
13 Norris Road, sir.
Well, don't tell me. Write it down.
Yes, sir. And how old are you?
22.
And what's wrong with you?
I thought you were supposed to tell me.
Ask Miss Walker why she went to the doctor.
Oh, about the lump.
And where exactly is the lump?
In the breast.
Lump in the chest.
Breast.
Lump in the Shall I examine her now, sir?
My God, Upton, you're a fast worker. Aren't you going to ask her anything else?
Anything else?
Any questions you might have forgotten?
No, sir. Oh, yes. What is your religion? No! Do you want me to ask all those questions, sir?
No, Upton, no. Don't bother. A brilliant diagnostician like yourself obviously doesn't need to. But we can discuss that later. You better just examine the patient.
Yes, sir.
Very impressive, Upton. Can you get BBC Two on that thing?
Pardon, sir?
One of these days, Upton, you'll find that expensive instrument very useful. In about 20 years' time, when you've learned how to use it properly. In the meantime, remember, the most important part of the stethoscope is the part between the ears.
Yes, sir.
Now put it away and begin your examination properly.
Yes, sir.
Stop! I think Miss Walker can manage that on her own. Would you mind, please? Now, Doctor, examine the breast. For God's sake, Upton, you'll frighten the patient to death. You look like Sweeney Todd. What do you think you're doing?
I'm warming my hands, sir. I've read about it.
Get on with it.
Yes, sir.
Stop! Keep your grubby little paws to yourself, man. Look first, look. What do you see?
Well,
Anything unusual?
yes. No. No, I mean, no.
Neither do I. Now palpate.
What's that?
Feel, Upton. Feel. What do you feel?
Oh. Well, she's got a sort of, lump. Sorry.
What sort of lump?
Well, a sort of, lump, really.
Where? On the end of her nose?
No, sir.
Well, where?
No. In her, chair.
Tell me about it.
Oh, God.
Please.
Well, it's sort of, lumpy.
I have spent all day telling you how to describe lumps. Position, shape, size, surface, remember? How big is the lump?
Sort of normal size, sir.
It can't be normal or she wouldn't be worried about it. Take your hand away. Now, is it the size of a football or a pea?
It's about, so big.
About the size of a plover's egg, would you say?
A plover's egg, yes.
All right. All right, that'll do. Thank you.
I hope everyone enjoyed the video, and with that note, we'll be moving on to our OSCE and OSPE section now, so I'll hand you over to Nail Ali.
Hi, my name is Nail Ali. I'm a final year medical student, and today, for the last part of this session, I'm just going to be talking briefly about your final two exams of year 3, the OSCE and the OSPE. I'm sure you heard these terms before, but let's just talk about them a bit. So if we can get the next slide, please. Okay, so in this session, we're just going to talk a bit about the exams, how they usually come, what's the format, and let's see some examples of these exams. Okay, so next slide. So just by way of getting it out of the way, so OSPE stands for Objective Structured Practical Exam. Although it says practical, it's really a multiple choice exam that's written, and OSCE, as you've probably heard and used the term before, is Objective Structured Clinical Exam. So this is a physical exam where you'll be seeing real patients and performing exams or tasks and are supervised by an examiner. So these are the final exams of 3314 and year 3. So what does each exam come like? So OSCE, so it's a clinical exam, as I said. So the exam is broken up into a series of stations. So stations are essentially tasks. So you would remember in year 1, you had a skills continuous assessment where you saw a patient and you had to perform an exam with an examiner marking you. So think of a series of those types of assessments in the same time, so that's OSCE. Usually get around 10 active stations and rest stations, which, as the name implies, you don't really do anything there. You just sit down and wait for the time to be up. So the exam comes with physical exams, as you all know. So for example, cardiovascular, respiratory, cranial nerves, etc. You can get asked to take a focus history on a patient with a given clinical scenario, and you can get asked to demonstrate skills you would have acquired from PEC, like, for example, breaking bad news. Okay, so that's OSCE. So OSPE, so as I said before, it's a written exam. So it's a multiple choice. If you remember how your MDSC 1002 10B spotter was, so it's similar to that. So you get around 60 questions with a minute per question, and it's important that you know there's no review at the end. So the question is only up for 1 minute, and that's it. So if we can get the next slide. So let's talk about the multiple choice exam. So Jeremiah previously spoke about the clerkships and pharmacology. So those are under the year-long course 3314. And essentially in OSPE, you're tested on that material. Now, you may have seen Jeremiah's slide and say, well, this is a lot of work, so you don't know how the questions could come. Well, the questions are really designed that you can answer them in a minute. So nobody's going to ask you a detailed complex mechanism, but they'll ask your ability to test not just your recall, but your ability to solve problems based on the teaching of pathology and paraclinical sciences. So sometimes they straight up ask you a question like which of the following is, or they give you a scenario to test your thinking abilities. Sometimes they give you an image that may or may not help. Sometimes they don't. So similar to 10B. And just one point I want to highlight. So I said a minute per question. Time in the exam flies. You need to stay alert because sometimes your head could just be down shading the answer and suddenly look up and there's a whole new question up there. So I'll give you just a personal experience of mine, not in year 3, but in year 1 actually. So we had reached an immunology question. So the question on the image that accompanied the question was a basic diagram of antibody. And what happened is that that image was used for the next 2 questions. And what had happened is I shaded the answer for the question and wasn't really paying attention. And it's only like halfway through the next question I realized, oh wait, the question changed. And OSPE can come similarly, so you need to stay focused in that exam. Because if you just lose that question, you lose focus, you lose that question. And just to emphasize, there are no repeats. Okay, next slide. So now I just want to give you an example of how OSPE questions could come. So you might be thinking, well, we haven't done pathology yet. We've only done 1 or 2 days of year 3. We shouldn't be expected to know how to answer this. Well, I said the questions are designed to be answered in a minute. So you can go ahead and type on the chat or unmute your mic and say it. If you look at the structure more on the right-hand side of this image, are you noticing anything familiar? Yes. Yes, so you can highlight the right-hand side of that image. So obviously, you see this portion is centered and might be the pathology, but does that structure look familiar? Well, it should because you covered it in year 1. This is cardiac muscle. So just by way of knowing your preclinical, so yes, Kadeem put in the chat, yes, so this is cardiac muscle. So just by way of knowing your preclinical, if you look at the options on the left-hand side of the screen, so option A says pulmonary TB, so lungs, so no, we're looking at the section of the heart. B, rheumatic heart disease, possible, because we said this is a heart pathology. C, CNS lymphoma, well, no, we said that we're dealing with the heart. And D, infective endocarditis, it's dealing with the heart too. So you see, just by knowing your preclinical, at least, you now have a 50% chance of getting it right. And when you study 3311 and attend more of the events of the Pathology Club, you will know that the image on the right-hand side is showing what is called Ashoff's body, which is found in rheumatic heart disease. Okay, so next question. So this is a ChemPath question, and this is a scenario. So you're dealing with a dehydrated patient. Patient might be vomiting, they may not be able to eat, and you're worried they have some sort of electrolyte disturbance, like say a hypokalemia, etc. So you decide to check their electrolytes. So this is something you learned in 10B. Which of the following blood tubes would you use to measure the serum electrolytes? You can go ahead and answer in the chat. A, B, C, or D. What color tube would you use? Any takers? Okay, don't worry. I know today might have been long, so the answer is actually C, the red top tube. So the red and purple tubes are probably the most common tubes you'll use in the hospital. Essentially, the red is where you'll take most of your biochemistry investigations, and the purple will be used for complete blood counts. So and for paraclinical and your clinical life, know what each tube is used for and the anticoagulant that is in it. Okay, and next question is a microbe question, which trust me, as you go through year 3, you'll love. So this is a straightforward question asking you different types of culture media. So the question is asking you, what's an example of a selective culture media? So to know this, you need to know what are different types of culture media is. So I don't expect you to know it for sure. You may have been exposed before in 10B, but essentially different types of culture media. So you have examples like A, which is a basic media where essentially anything that could grow will grow. You have enhanced or enriched medias like B and C. Essentially, you add something to the basic agar to help organisms grow. You have differentiating agars like McConkey, which you could tell lactose fermenters. And you have examples like D, which are the selective medias, which allow one organism to grow. So the example here, D, you use to culture Neisseria gonorrhea. So essentially, it's a modified plate where you have antimicrobial agents that stop everything except Neisseria from growing. So that just shows you how you apply your knowledge of both pre and paraclinical to answer OSPE. So now just let's come to OSCE. So as I said before, usually 10 stations, each station is about 5 minutes per station, and you have 1 minute to leave the station you just finished and go to the next station and read the instructions. So one thing, I know you'll be nervous for the exam. You might have felt nervous when you entered the station the first time in year 1 for your continuous assessment. Read the station. There are instructions for a reason. And don't worry, although you're nervous, on the day there are invigilators there to help you, because sometimes you have to go right and you end up going left because you're stressed. Don't worry, there are UWI examiners there to help you. Okay, so how do you actually go about learning for OSCE? So you remember Skills Lab. I'm sure you remember Skills Lab. So you're taught how to perform a skill, like for example, you're taught how to perform a cardiovascular exam. But it's important that you know that for OSCE and for future life, you can't just know how to do a skill, you have to know why you do a skill. And when you find a certain finding, what does it mean? So OSCE tests both your skills and your knowledge. And it's the knowledge over the 3 years. So year 1 skills, year 2 skills, year 1 and 2 professionalism and ethics, and year 3. So what type of stations can you get? So obviously you can get physical exams, like for example, you could get asked to perform a respiratory exam. You can get asked to take a focus history. You're given a complaint and you have to talk to a patient. You can get asked to demonstrate a practical skill. So usually you demonstrate these on practice models, similar to what you did in Skills Lab. So you can get asked to take blood, to perform a rectal exam, to perform basic life support. And I just want to take a moment and pause and talk about BLS. So basic life support is a skill that you cannot not know. You have to be able to perform basic life support. So it's what is called a pass or fail station. So it's weighted very heavily, where you must pass that station in order to progress to clinical years. You cannot be a doctor or trained to be a doctor in clinical years and not know how to do BLS. So if you feel like you have forgotten how to do BLS, it might be worth going back in notes, going back in resources and learn to perform the skill, at least in theory, and then when COVID permits that we get to go back to Skills Lab, practice basic life support. You have to know how to do basic life support. Okay, so moving on. So I put PEC here, but these stations are communication stations. So not just PEC. Remember, for the rest of your life, you're dealing with real people. You have to know how to talk to patients. You're gonna have to, some days, tell someone they have cancer. Tell someone they're going to lose their leg. You have to know how to tell the patients bad news. And sometimes people might not take news well. You have to learn how to deal with angry patients, and these skills are tested. And finally, you might see something called unmanned or written stations. But you might be wondering, well, I said this is a practical exam. So what unmanned stations are is that you are asked to complete a task, usually an assignment, in the 5 minutes, but you're not reporting to examiner, like, and you don't have a patient in front of you. So you might have an invigilator just there to, for example, facilitate the station, like for example, sit you and give you the question sheet, but it's not that you have to report to an examiner. I'll just give you an example later on. So if you can get the next slide. So physical exams, as I mentioned before, you know the physical exams, abdo, resp, etc. So this is an example of how 2 stations could come. So if you read the instructions here, so you see the first station, station 6, asks you to perform an abdominal exam. You have 5 minutes to complete your task. This is literally what it might say. Sometimes they might give you a scenario, but more often than not, they just simply give you an instruction. And I just put station 7. You're asked to perform a hernia exam, because we all know when we finish our abdominal exam, we say, yes, so ideally to conclude this exam, I would examine for hernias, examine external genitalia, and perform a rectal exam. So some people feel they can't get a hernia exam. So I just put an example to let you know it is possible to get asked to examine hernias. And often for preclinical students or students who haven't been in the wards yet, they often tell the students to they'll have a male patient and you're asked to palpate over the patient's underwear. So you might just want to politely ask the patient to lower it a bit to inspect, but for palpation, usually you're asked to put on gloves and you palpate over the patient's underwear. I just wanted to let you know that. And again, you have 5 minutes. Okay, so for history taken, so you know how to take a history. So this is how it could come in the exam. They give you a case, there's a patient with you, there's an examiner, and you have to take a focus history. So you have 5 minutes, read the instructions carefully, to take the history and to give a diagnosis. So this isn't the normal history where you ask every single thing, like family history, social history, which could take 5 minutes by itself. You want to focus and tailor history to the patient. So your lid are endocrine block. So if I have a middle-aged female who's presenting with a neck swelling and palpitations, anybody want to hazard a guess of a possible diagnosis I'm looking towards? You could type in the chat any broad condition, any disease of a particular organ or system that you might have been taught. So yes, hyperthyroidism, good, thyroid disease. So and next one, palpitations. So palpitations are a common symptom of hyperthyroidism, which could feature enlarged thyroid, as Alex said in the chat, and that could be the reason for the neck swelling. So you're gonna want to focus the history on that. So you want to ask symptoms of hyperthyroidism. So you're gonna ask about weight loss, heat intolerance, difficulty sleeping, increased anxiety, nervousness, so forth. And her menstrual cycle, because remember you're dealing with a female patient, so you want to ask about menstrual cycle. And if you think about the neck, so you have 2 important structures in your neck, your trachea and your esophagus. So you're gonna ask about difficulty breathing and swallowing food. So a lot of people forget that because they think, okay, I just need to ask about the thyroid, but remember, you're being trained to deal with a real person. So you need to stop thinking like things occur in isolation. If you have a large swelling here, it could affect how you swallow food, which could lead to nutritional abnormalities. And well, you also want to ask important supplemental questions like, is there a family history of thyroid disease? So after taking about 3.5 to 4 minutes asking all these questions, you want to summarize for examiner. So you're going to say, okay, so this is history of a 40-year-old female who presented with a 2-month history of neck swelling and palpitations associated with heat intolerance, weight loss, menstrual disturbances, and a family history of thyroid cancer. So the examiner is going to ask you, okay, so what is your diagnosis? Or you can just say, based on this history, I would like to give a diagnosis of hyperthyroidism. And the examiner could ask you, okay, so can you tell me a cause of hyperthyroidism? And in this case, you could say Graves' disease, and they might ask you how you would investigate, and to say a thyroid function test, free T3, free T4, and TSH. So that's how you'd answer history station. Okay, so moving on for practical skills. So I didn't really put an example of a practical skill here, but I just wanted to let you know you perform these skills on a practice model, but for all intents and purposes, that is a real man or woman sitting in front of you. You need to demonstrate that you have the skills to treat that person with respect. So walk into the station after you do the needful, you sanitize your hand, you give the examiner your slip, you say, "Hi, good day, my name is so-so-so. I'm a third-year medical student. I try to identify a patient." Some examiners help you and say, "This is Mr. John Smith." Some don't, so what you would say is, "Are you John Smith?" "Yes, you are. Nice to meet you." So it's a real person you're talking to. Play pretend. And know that an examiner can ask you questions for these skills before, during, and after performing these skills. So you have to know what you're doing. So let's say you're doing asked to perform a rectal exam. I'm sorry about that. I think I got muted for a second. Amory, can you just confirm where I got muted?
You were talking about you're asked to perform a rectal exam.
Okay, thank you. Okay, so you get asked to perform a rectal exam. There's this model, the same one you dealt with in skills lab there. So you introduce yourself, you explain the nature of the procedure, you invite the patient to remove their lower garments. So you say, you would already explain to them how they need to be exposed. And you would say something like, "Okay, I'll step out the room and you can call me when you're ready." And the examiner will be like, "Okay, just position your model now." So you put your model in the appropriate position, cover them with a sheet if it's available. Might not be available, but just say you would. Then you perform an exam, and let's say your finger's in, and the examiner stops you and asks you, "Okay, so if you're feeling, what are you feeling for?" So it's a male dummy, and you could say the prostate. So they'll ask you, "Okay, so if I told you this was a 70-year-old man with benign prostatic hyperplasia," they could ask you, what would you feel?" So you have to know what a BPH prostate would feel. The prostate will be enlarged. You could have loss of the medial sulcus. And a classic question they like to ask, not here alone, but like medical schools throughout the world, they often ask you, how would prostate cancer feel compared to BPH? And a common analogy is forehead. You feel your forehead hard, that's cancer. You feel the tip of your nose firm, that's BPH. So I didn't get asked that, but that's a question, easy go-to question for examiners throughout the world. So don't be surprised if you could get asked that question. And that's it for practical stations. So I didn't really talk about PEC stations, the communication stations, because you all got exposed to that in year 2. But this is an example of what unmanned station can come. So you go to a station, it's a desk, so you'll have an invigilator in the corner. They're there to, for example, seat you at the station, give you your answer sheet, but they don't ask, they may not ask you questions. Sometimes you might have an examiner, actually have an examiner here, but the examiner will literally just read out these questions and ask your responses. But more than often than not, you don't get an examiner. There'll just be an invigilator there to guide you to the station. So anybody wants to hazard a guess for the first question? What imaging modality are we seeing here? So obviously we're seeing organs, but What are we seeing here? Is it an X-ray? Is it a CT? Is it an MRI? Any takers in chat? Okay, so it's between the okay, so I see someone put a CT in the chat. So yes, this is an axial CT of the abdomen. So correct. So in the exam, you'd write that, an axial CT. Because when they say modality, they want to know that you know what image are you looking at and how is the image taken. So similarly, you know, you can take a chest x-ray anteriorly or posteriorly, or a PA chest x-ray, and you'll see that more in your clinical years. So that was one question. And then the second question just asks you to label structures. And this you have to rely on your preclinical knowledge. So you all had cadavers, you all had anatomy atlases and textbooks. So if we look at this image, we see 9 is clearly the liver. It's on the right-hand side. Remember, for reading a CT, it's as though you're looking at the patient from the foot of the bed. So the images 9 and 2 are taken on the right-hand side of the patient. So you see 9, this is the liver. So obviously, you know by your knowledge of anatomy, what you need for pathology, you know 2 is the right kidney. And the structure opposite to 2, on the left-hand side, 5, is the left kidney. And you see in 7 is an air-filled viscous, so that will be bowel. Given its size, I would say it's small bowel. But so that just shows you need to remember anatomy and all. And trust me, when you're in surgery in year 4 and year 5, they love to ask anatomy questions. So please know your anatomy. That's all I ask. All right, so next slide. Okay, so I know that was a lot to take in, but just to conclude, so OSPI and OSCE, your last exams of year 3, the exams standing in between you and proceeding to year 4. So for OSCE, the clinical exam, the best advice I could tell you is learn your work and practice. And did I mention practice? Practice any chance you get, because you want this exam down to muscle memory, to the point where you don't have to worry about learning how to do the exam. You can just learn get the knowledge base to answer questions. So you want, from the time they say perform a cardiovascular exam, you know one time how you have to move, what you have to do. So you can just focus on, like, for example, knowing how to examine for murmurs and how to present a murmur. And for OSPI, the multiple choice, which as we saw before is weighted heavier, learn your work, please. Don't just assume, well, I'm a very good person in skills lab, I don't need to do well in OSPI. OSPI will save your life, or it will sink you if you don't study for it properly. And as we know, things change every day in this pandemic. So what the future holds, we don't know, but this is essentially how OSCE usually comes. And I could just encourage you to work hard and to make yourself proud. Thank you for your time, everyone. I'll pass you back over to Anne-Marie.
Thank you very much, Nail. That was very insightful. It also brought back a lot of memories for us who just did our OSCE and OSPI this year. I just want to reiterate, even though you're home right now and you're not actually in Skills Lab, don't let that keep you back from practicing. Practice on your pillow. If you have a relative that you can practice with them. Of course, keep within these safe public health measures that we're in right now, but use your pillow. Don't wait until, okay, I can't practice right now, not in Skills Lab, I don't have Skills Lab. Don't let that keep you back. Make sure and keep practicing. Use your pillow. If you have a stuffed toy, something, just make sure and practice. At this point, does anyone have any questions? Feel free to ask about OSCE, OSPI, any of the courses we cover, topics we covered so far for year 3. Or if you're more comfortable, you can type in the chat. Okay, so in the meantime, if you have any questions, feel free to type it in the chat and we'll try our best to address it. Okay, so we'll just move on to a few study tips. So in terms of being home now in the pandemic, we have been actually given, if you look at it in a different way, yes, things are a bit really bad right now, but we have more time. Think about all the time you would have lost in traffic, going to and from school and classes. You have a lot of time now, so please use it wisely. Try not to procrastinate and make sure and do your work and revise and so forth. Also, everybody, I'm sure, feels like this more often than not, or a lot of the times. And you might think, okay, I can study better at night, and then you fall asleep. So you have to be aware that, you know, when you lose this time, you're not going to get it back. So you have to make sure, as my colleagues would have reiterated through the night, to make sure and plan, make sure you have a plan and schedule your study sessions in wisely. You also have this thing where, you know, you're looking at your book and you're trying to study and you're literally not reading anything in the book. That has happened to everybody, trust me. So make sure take breaks, make sure plan that you have breaks in between. If you're tired and mentally drained, you're definitely not going to retain everything. So make sure and take breaks. In terms of distractions, so home now is like you're constantly distracted by everything around you. So you have to be careful on the distractions. So don't go start to watch no Netflix series when you have work to do. Yes, take your breaks, maybe plan a show to relax in between, but be careful because you know how Netflix can become very addicting. So be careful of the distractions around you. Plan your study area carefully. So know where you're studying. Don't say, okay, I'm going to sit down on my bed, and you very well know you're not going to be able to study on your bed and you're going to end up sleeping. So make sure you have an environment that is conducive to studying and make sure that you can focus as well. So there's something called a resource overload. So we live in this digital age where there's so many different resources. It's like you don't even know where to start. So you have to be careful of having too much resources. So as we said, choose what works for you, know what works for you, know if you have textbooks out, know what books you're going to look at. If you have videos, choose the videos like osmosis or so, but know what videos you're looking at. Try not to go and you have 15, 20 resources and you realize you spend more time looking at resources than actually studying your work. So as my colleagues would have reiterated, don't leave things for last minute. Cramming is not going to work. We have told you about this throughout the night and we just want to reiterate, cramming is not going to work. It's definitely not going to work. It will end in tears. So revise regularly. Don't leave work till the last minute. So I just want to highlight something called Ebbinghaus forgetting curve. So he was actually a German psychologist who did a lot of work with learning and memory. And the reason why I'm highlighting this is there's something called the power of spaced repetition. So there's actually scientific evidence that proves that the more you repeat study sessions is the better, more long-term memory you're going to get. So rather than you sit down one day and say, okay, I'm going to study this entire topic one day, you may not retain as much as if you constantly repeat. So if you try at the end of the session, but try in different formats. So rather than reading the lecture notes all the time, say, okay, I'm going to watch a video now, I'm going to watch my flashcards now, and then I'm going to watch the lecture notes that. So you kind of change your medium in which you're using to revise. So these are some suggestions here we could do at the end of the session, then you have a short break at the end of the day. You could do it on a second morning, the next day, a week later, and every few weeks. And this is one of the ways that you're going to help you remember. So you don't want to reach at the end of the semester when you reach in year 4, it's like it's gone with the wind because you literally do not remember what you learned in year 2 or even in year 3. So they actually show evidence to say that when you revise multiple times with the spaced repetition, that look at the stark difference rather than if you don't repeat compared to if you repeat a couple of times. And this is just a few times. It doesn't have to be that you have to go and read the whole 200 and something PowerPoint lecture slides. As I said, use a video, something that just kind of reinforces the information that you would have learned. And definitely would encourage this a lot. So now in terms of med school life, so we know that we all can all feel a number of ways when people say, okay, in med school, you know, you have your life together, or they asking you good, and yeah, I'm good, but you're completely stressed out, right? Because med school is a lot, and as my colleagues would have reiterated, year 3 is a lot. It's a lot of work, and you have to know how to pace yourself and know what works for you. Right, so I know that even with the pandemic situation, we're a little and the dynamic situation that it is, where it's constantly changing. We have a lot of anxiety and uncertainty, and we feel maybe a little disadvantaged that the situation is not ideal right now. And I want to reiterate, as Jeremiah would have mentioned, the importance of your mental health. Year 3 is tough. We're not going to candy coat it for you. It is tough. So you have to make sure, if you're feeling overwhelmed or you're just feeling like you can't make any more, reach out for someone, reach out to help. There's no shame in that. You're no less of a person, and nobody's going to think any differently of you if you reach out for help. It's okay not to be okay. And we have the counseling and psychological services at UWI. They are functioning. They are doing online sessions. And as you can see here, this is the email address. And even if you don't feel comfortable going maybe to a counselor, you think, okay, that's not for me, talk to your friend. And most importantly, look out for each other. If you realize that, okay, you're not hearing from somebody you normally hear from, find out what's going on with them. You never know, just by reaching out to them, that could really help a person. Right? So as I said, you are here, right? So these are your crossroads. You're in between your paraclinical to clinical years. And this is one of the most important years of your medical school, of your medical career, and even for your future in medicine. I want to reiterate, don't give up. You can do it, as Jeremiah said. If we can make it, trust me, you definitely can, because it's not an easy road, and we have all been there, and we've all been through all the troubles. And we know that this has taken perseverance, determination, resilience, and an indelible character that refuses to give up despite the circumstances from each and every one of us here today. And I hope and I trust that you're so proud of yourself that you have made it through the past 2 years. And I want to let you know that don't compare yourself to others, as Jeremiah would have said. Don't doubt yourself, because there's no other like any one of us. So it doesn't work when you're comparing that somebody, because I'm saying, yeah, I mashed up 15 lectures this week or something like that. You have to know yourself. Don't compare. The only person you should be competing against is your own self, to be the best version of yourself. Don't put yourself down. An important thing that I want to really highlight is to not compare yourself to a grade on a piece of paper. That grade on a piece of paper is not something that defines you or who you are or what you're capable of. And I know it's kind of be hard when you're trying so hard to get good grades, but be in mind that this grade is not just what is going to save somebody's life one day. Stay true to yourself and don't lose heart. So I just have some final thoughts. As I said, this pandemic situation is definitely not ideal. But as we see in the great words of the great Martin Luther King Jr., he once said that the ultimate measure of a man is not where he stands in moments of comfort and convenience, but where he stands at times of challenge and controversy. And we know the situation is not ideal, but it's going to make you a better person in the long run. So I just have a few final thoughts before we end. So I know that with the overwhelming workload of medical school and the constant pressure to get good grades, it's very easy for us to lose our way and forget why we are here studying medicine. So I just want everyone to just take a few seconds to think about, why did you choose to study medicine? Why are you here? Really think about that, because when we wrote our autobiographical statements to come into medicine, it's very easy for anybody to write exactly what we think they want to hear. But over the years, I think each of us now, having going through 2 and 3 years of medicine, would think, okay, I wrote this statement and that's not really why I chose to do medicine. I want you to really think about, why are you studying medicine? Why are you truly here? So everything we are learning and trying so hard to remember is not just to be able to answer a question in an exam or get a good grade, as I said. But this is everything you're learning, is learning for life, as Jeremiah said. We are going to be prepared for the day when we are the only thing between a patient and a grave, and it's going to give us the privilege, honor, and ability to save someone's life one day. And I really hope and pray that we never forget this, that we are studying medicine for no other reason than to dedicate our lives to the service of others. So when you think about it, instead of getting stressed out with all this work and this workload and year 3 and this overwhelming stack of lectures that you have to go through, and you really sit down and think, wow, I'm going to be able to save somebody's life one day with this information. And you just change your perception just a little bit about why, and stop worrying about, okay, I need to get this GP, I need to answer this question. And you really sit down and think about it, and you find your passion and why you're in medicine is definitely going to help. So I really hope that this words of encouragement really helped and really resonated with you all tonight. And now I'll pass you over to Samantha, who will give the vote of thanks.
Hi, Anne-Marie. I just had 2 things to add before you finish.
Sure.
Just 2 points concerning OSCE that was mentioned to us by 2 different lecturers that I just want you guys to think about, well, if after this pandemic, you actually get to do face-to-face OSCEs, because we don't know how the situation will turn out to be. But if when you're actually going in, we know everyone has nerves and everyone is nervous in the exam, and you just might want to go and just do your running commentary and get the exam over with. However, it is important to say good morning to the patient and also the examiner within the room, because the examiner told a group of us, they was like, sometimes the students just rush in the room, say good morning to the patients, and don't acknowledge the examiner in the room. So it's always nice to say good morning or good afternoon to everyone within the room, and to acknowledge the examiners present, because the examiner could be a family, could be, when you're actually taking care of real patients, you can have family members in the room with the patient. So you have to know to acknowledge everyone within the room also. Another point was brought up. When you are doing your OSCE, you have a paper with different sticky notes, sticky notes where you write your ID number on, and you have to give one to each examiner. You're so nervous, sometimes you just hand the whole paper with all the notes over to the examiner, and you expect the examiner to take off one of it and put it on your form to be able to grade you. Some examiner actually told us that sometimes the students do that and they just keep it. And until the student goes over to the next station and then forgets that they left it in the previous station, have to come and have to backtrack to get back their notes. Or sometimes they don't even, the examiner spends a long time to give them back it. So make sure before, when you're reading the directions on the board, take out a single one time and just probably stick it on your wrist, or just hold it in your hand, stick it on your finger. So when you go to the examiner, you just walk up to them and hand them the single one time. So it make a smooth transition. So when you're starting and talking to the patients. And that's all.
Thank you, Kanisha. That's definitely some important information that you'll need to keep in mind. Before we close, actually, are there any questions that you thought of that you didn't get a chance to ask and you wanted to address now? We have a few minutes. You can type in the chat or you could ask. Don't feel too shy.
I'm very excused. So I saw some questions in the chat relating to OSCE.
Sure, go ahead.
Mind if I answer it? Okay.
Yes, please, go ahead.
Okay, so I saw one question asking about the instrumentation you'll need, what instruments you'll need for OSCE. So, okay, so first things first, stuff that you use a lot and use for yourself personally, like your stethoscope, of course you'll need it. So for OSCE, you'll be walking around in your lab coat with a lot of your equipment on hand. So things I would say for sure, and sorry, I don't have like a definitive answer, but I can always prepare something more definitive. But essentially, I had a stethoscope, your measuring tape, a tuning fork, a tendon hammer, must have those for sure for the various exams I needed for, and other pieces of equipment, like for example, you got introduced to the ophthalmoscope and the otoscope. So those pieces of equipment, at the beginning of skills lab in year one, you might have noticed on the notice board, you're asked to have those pieces of equipment, but usually for OSCE exams and clinical exams, equipment like that is provided for you. So they have it at the station. So they'll have one, it'll be on the wall, or it's in like a port, and you just use it at the station. I'm not sure how COVID might affect this, but essentially, like, you know, your basic equipment, your stethoscope, your pen light, your measuring tape, tendon hammer, have those. I could just prepare a list and perhaps forward it to someone in year 3 to help you. I saw another OSCE related question relating to supervisors, examiners, and if they can stop you during exam. So the answer is yes, they can. However, it's at the discretion of the examiner. So some examiners actually leave you alone for the 5 minutes and they let you do the exam. Some, if they see you're doing something questionable, or honestly, if they just feel to question you, they can. So the answer is yes, they can stop you in the middle of exam to ask a question, but they generally understand you have 5 minutes to perform your task, so they try to keep it at a minimum. If your action is, for example, breaking instruction, like for example, I mentioned at the hernia station, you're asked to palpate over the patient's underwear. If they see, like for example, you're attempting to raise the patient's underwear, like lower the patient underwear, they might say, read your instruction, so something like that. So yes, they can stop you, but they usually stop you with good reason.
I wanted to bring up the points that someone mentioned, equipment, right? So sometimes, for example, for a catheterization station, right? If your last name is early on and you're going on in one of the early groups, you might see everything laid out nicely. You might have all the equipment ready for you to do the station. However, if your last name is later down and you are in probably in the afternoon session or the later half coming on before they break for lunch, you might walk into the station and everything is a mess. You might see glove packs, you might see everything laid out and it's looking like a tornado basically passed through the station. So you have to make sure and try and know the equipment you need to have to be able to perform the exam, to perform the catheterization. And basically you might have to be able to search through all the rubble to be able to find what you need. I know examiner brought this up to us when we were having our practice sessions. Sometimes like we say gowns or gloves and something might be underneath the dummy, or it might be hiding underneath a piece of wrapper or paper. So you have to look and search through the station within your time to be able to find everything. So just be mindful of that and be mindful and considerate to all your colleagues going after, because you might start at the catheterization station and everything might be laid, well, if it comes, everything might be laid out nice and neat, and you might use a glove and just leave the pack there, and then the next person coming after, they have to deal with all that rubbish and everything all over the place. So when you're done with it, just take it up one time and have bins all outside, inside the room, and just throw it away one time. Please be respectful to somebody else coming up after you. I know sometimes you might be nervous, you might have a tendon hammer. If you're doing a cranial exam, you might have a tendon hammer available within the station. You might be nervous and you actually pick up the tendon hammer and continue on to the next station, and the person after, they don't have their own tendon hammer and they don't have anything to use for that station. So if you pick up anything and use it from the examiner, please leave it in the room so the next person will have something to use. And I think that's all the points I had.
Yeah, so just make sure we truly know how nerve-wracking it could be. Make sure and just take a few deep breaths, focus, try and stay focused. If you walk in a station and you see it's in a mess, don't get upset because that's going to throw you off really badly. Just take a few breaths, focus yourself, okay, what am I going to do? What am I coming to do? What do I need? And you just move on. Don't let yourself get upset over something, because that's definitely going to throw you off for the rest of the whole entire OSCE. So with that in mind, I really hope that everyone enjoyed, and we really hope that the advice and so forth helped everyone. Just pass you over to Samantha now. She'll give the vote of thanks.
Thank you, Anne-Marie. Good evening once again, everyone. It is with great pleasure that I now present the vote of thanks for this evening's proceedings. As Meister Eckhart once said, if the only prayer you ever say in your entire life is thank you, it will be enough. Firstly, I'd like to thank our featured speakers and your very own peers, Saksha Mehra, Jeremiah John, and Nail Ali, who graced us this afternoon with an amazing, simple, and understandable breakdown of the full Year 3 experience. I am sure that you all are as thankful and extremely grateful for such a head start on your Year 3 experience. Additionally, I commend all members of the executive for working so hard to make this session a success. Special thanks to our president, Ms. Anne-Marie Minghon, for this innovative idea. Firstly, we are extremely grateful for all of you who came out to make this event a success, and we hope to see you at our future events. Ladies and gentlemen, this marks the end of our program tonight. Thank you for listening, and I wish you good luck throughout your year 3 experience and the rest of your years of medical school. Good night all.